Hi again, and welcome back to past physiology review of topic 6, the integumentary system. This is part 2 of our little video series covering the content that you're going to need to know for your final exam, or half of the content, because topic 5 and topic 6 are both in the final exam. So in the first video, which hopefully you've already seen, we went through in a good amount of detail an introduction to the integument or the skin, and the epidermis, the dermis, and the hypodermis, and the cells of the epidermis, including more into detail with these different sensory receptors throughout the different layers of the skin. Remember, the color coding is consistent throughout this, so anytime you see yellow, green, pink, red, it means it's in the yellow, green, pink, or red appropriate layers outlined right here. One thing I didn't mention in the first video is that technically the hypodermis, or the subcutaneous layer, or the superficial fascia, technically that's not part of the skin. It's not classified as part of the skin or as technically part of the integument or integumentary system. The name sort of implies that, but it's, I don't know if that's going to come up on a question or not. But technically, okay, the subcutaneous layer is not part of the skin. It's more of a fascia or connective tissue. So if you get a true/false question, true or false, the hypodermis is classified as part of the integument. Technically, that's false. You never know. So it's below the dermis, hypodermis. Subcutaneous, under cutaneous. Cutaneous means skin, so it's under the skin. And superficial fascia maybe is a better way to think of it, because that sort of in your mind separates it from classifying as part of the skin. Okay, so we've talked about most of the stuff you see on the screen. I'm going to scroll down to skin color. We're going to talk about skin color right now. On the left side of the skin, I've got table 18.1 in your Junkiera text, and this is showing you basically the same things that we've been talking about. It's got more detail than you necessarily need to know, but it's good to look at different sources to get a different look, different perspectives on things and different ways to classify it in your mind. So you've got the epidermis, dermis, and subcutaneous layer with their little pictures and describing things over here on the right. With the specific layers right here. Go ahead and review this if you think you need to. You can pause the video and just read through all of this. I'm not going to read through it again, but I just want to highlight that is a nice table. On the right, we see skin color, okay, and in blue is just these different functions of skin color, kind of. That's why I put it in blue. Anything blue is like function. So arrows up means more, arrows less means less. Sorry, arrows down mean less. So arrows up with UVR, that means more UV radiation, corresponds with more melanin. Melanin is a sunscreen. The more UV radiation you get, the more melanin your body produces in response to the UV radiation, to basically block the excess UV radiation, to protect you, from skin cancer, to protect you from too much sun. If your ancestors are from Africa or southern India or Southeast Asia, they're near more intense sun and the environment all the time, and so they've adapted this darker pigmented skin because their melanocytes, same number of melanocytes as anybody else. Supposedly we all have the same number of melanocytes, but they needed more melanin. They needed more sunscreen, so they had more. Men have more melanin than women. That's a sexual dimorphic difference. And as you age, you have more melanin in your skin as well. So older people accumulate more melanin. Lighter skinned people are going to have increased vitamin D making ability because they have less sunscreen blocking out UVB radiation. Remember, you need UVB radiation acting on 7-dehydrocholesterol in order to form vitamin D3, cholecalciferol, which then travels to the liver, right, to be turned into 25 hydroxy and then to the kidneys to be turned into 125 dihydroxycholecalciferol. That old pathway. So if you have real light skin, you don't have as much sunscreen blocking UVB, so you can make way more vitamin D way faster than somebody with real dark skin because they have more sunscreen. When I say sunscreen, I mean melanin. But also lighter skinned people, since they have less sunscreen, they have more incidence of skin cancer. Okay, those two correspond pretty nicely if you understand why. Darker skinned people are going to be more prone to frostbite because if you can just imagine that, darker skinned people are from warmer climates, and they didn't necessarily need this ability to resist the cold, because anywhere where you have intense sun, right, think of the equator, you're not going to have freezing temperatures. So that, if you just think of this from an adaptation perspective, dark-skinned people from warm areas ancestrally, they didn't need to guard against frostbite, and so now they're more susceptible to frostbite. Whether or not that's the true mechanism, I don't know. I don't know that for sure. I don't know if it's well known or not, but that's enough to get you the question right. Dark-skinned people more prone to frostbite. They also are less prone to skin cancer because, once again, they have more melanin as a sunscreen in their skin, blocking out excess UV radiation, which in excess, and when the body's systems are not performing optimally, you can mutate cells and cause those skin cancers. So, why are we yellow, brown, black, or pink? Well, yellow pigment can come from excess carotene, as in like vitamin A rich foods, carrots, sweet potatoes, things like that. Excess carotene in the diet can turn a skin kind of yellow, or East Asian people have a very thick stratum corneum, which is full of lots of, they have more keratin in their system, which can produce a yellowish pigment. So carotene through food, or keratin in a thicker stratum corneum in East Asian populations, that causes yellow skin. Brown and black pigments are from melanin. When you tan, you're subjecting your skin to UV radiation, causing all your melanocytes to start producing more melanin to basically darken your skin to protect you from all that sun that you're exposing it to. So in response to the sun, your skin starts turning more brown because those melanocytes get to work making melanin sunscreen. Or if somebody is black-skinned, they're innately, natively, that's their family lineage has always produced this black skin because they needed it, I guess. From the evolutionary perspective, their skin needed to have that UV protection from an area with intense sun in equatorial Africa, Asia, or wherever. So another note, just a reminder, because this is probably an easy question to trick people on. You should know that everybody supposedly has the same number, or about the same number of melanocytes. It's just that production of melanin is what is variable. So freckles are just little islands of melanin production, and a mole, later you'll see a mole is actually increased melanocytes bundled up together. These different types of melanin here, you don't need to know them for this class, but they're just kind of interesting. If you want to Google them, or if you have red hair, maybe pheomelanin is interesting to you. If you remember from CNS, the substantia nigra contains neuromelanin. These are all different forms of melanin oxidized from tyrosine, that amino acid. Eumelanin makes brown or black pigments. Pheomelanin is what a red-haired person would have as their melanin. So their melanocytes produce pheomelanin, making that reddish skin, or red, not reddish, red. Freckles and hair and whatnot. And then neuromelanin is that black melanin in the central nervous system, especially substantia nigra. If somebody's real pale skinned, it just means that whether they have a mix of pheo and eumelanin or not, or whatever, it's just that they have just very little melanin being produced. so their skin is more pale. Or if the hair is blonde, it's because those melanocytes at that hair follicle are not producing very much melanin or any melanin. If you have dark hair, real black hair, it's because you have a bunch of eumelanin being produced by a melanocyte and pumped into that hair, basically in the bulb, technically, which we'll get to next down here. Wrapping up colors, why are you pink? That's just blood. So especially if you're fair-skinned, or especially if you're out running on a hot day or whatever, or if you blush even, okay, your blood vessels dilate, in response to heat, excessive heat, your blood vessels are going to dilate all over the place to radiate that heat out of the blood and cool the blood. So pink skin is just from blood vessels in the dermis and hypodermis. No blood vessels in the epidermis. So, just know that. Okay. So accessory organs, what are they? What are their functions? In blue box here, hair, nails, glands, sensory receptors. It's pretty straightforward. The hair protects your head, mechanically from abrasions and things, but also from heat and cold and from sun, probably more than anything maybe. It also can identify you as male, female, or just different people, whatever. Nails obviously provide protection, and also they are incredibly useful as a tool, okay, increasing your manual dexterity. We all know it's incredibly difficult to pick a booger with short fingernails. That was supposed to be funny, but it's true, okay? It's more true than funny, actually. Okay, glands, right, are in your skin for various functions. They lubricate the skin with oily type secretions, and protect the skin by keeping it moistened and whatnot. Also, they cool your body through evaporation. They excrete some waste products and sweat, like uric acid, okay, lactic acid, etc. And finally, sensory receptors live in the skin, which allow you to feel your environment. Fine touch, non-discriminate touch, pressure, vibration, and then the most superficial layers would be pain and temperature. We've already talked about that. So, in the first video, we talked about that, in case you didn't see it yet. If you haven't seen it, go watch the first video. So, hairs are in 1813 over here on the left. We're going to get down to it. If you've got your book, you can follow right along. This is going to show you a diagram of the hair with all the parts labeled. I'm going to zoom in a little bit here. And pretty straightforward. We'll start from the bottom up. The erector pili is going to be the little muscle that is going to be found in the dermis, and it's going to, specifically the papillary layer of the dermis, okay? You can see up here it's on this little nipple, the nipple layer. That's kind of where it's originating, and it inserts on the follicle of the hair. The follicle of the hair up here we're going to find is just a little housing for the hair to kind of live in, right? It's its little house. So the erector pili is smooth muscle. It is single unit smooth muscle, which you hopefully already know. It has its own nerve supply, and a nerve goes to this little erector pili, and when you need, when you get the goosebumps, this thing contracts and pulls this hair to make it stand on end. Yeah, that goosebumps, okay? Erector pili. Now, follicle, we already talked about a little bit, is the house for the hair. There are two layers to it that you need to keep straight. There are root sheaths, like a knife sheath. There's an outer sheath made of connective tissue, which this kind of shows in this diagram. It's kind of hard to see. The outer layer is connective tissue. The inner layer is epithelial tissue, okay, like epithelium, like skin type of tissue. And it kind of just makes sense. The outer layer is connective tissue because it's connecting it to the tissue, and the outer layer should just be tougher, right? So it's connective tissue. The inner layer doesn't have to be all tough. It is like your skin, okay? It's a nice soft layer of skin around the hair, I guess, okay? So Follicle has two sheaths: outer connective tissue, inner epithelial. You're probably going to need to know that because it could be easy to bungle, and so it's probably a good test question. Something else is that the follicle only houses one hair. Okay, it's a house for one hair only, and if this follicle has a crazy shape, the hair will have a crazy shape too. Hair texture and diameter, whether it's curly or not, or straight, that comes from the shape and size of the follicle in which the hair is born and lives in, and it comes out of. So this is all in the dermis. Then traveling farther up is going to be the bulb of the hair is mitotic. They're actively dividing cells, and also this bulb is where you're going to find melanocytes, which we already mentioned, produce melanin, which will dictate the pigmentation of the hair, whether it be blonde because there's not much melanin being produced, or black because of lots of melanin, eumelanin, or red because lots of pheomelanin. You don't need to know the different types of melanin for this exam, but for life, maybe it's interesting to just know that. The root of the hair, on this diagram here, we see it. It's a lot of area. All the way up to the surface of the skin is technically the root. They are dead, flat, keratinized cells, but they are still within the hair follicle. They're still inside the skin. Once it penetrates the skin and is outside in the world, it is the hair shaft. Okay, so that's in this little cell in this table here. It's in white because it's yellow is epidermis, so white is like not epidermis. It's in the outside world. The yellow is in the dead, flat, keratinized cells, right, of the skin. That's the same kind of condition that the hair is in. In the bulb, it's mitotic and actively growing, and it's in the mitotic layers of the skin. It's in the stratum basal. That's where the bulb is. Okay, the shaft is external to the skin surface. Okay, you need to know that. A little note in this table in the upper right corner is that as far as the origin of the hair, it's an epidermal tissue origin. Okay, it's in the note, so it's fair game. Just wanted to mention that. Now nails, pretty straightforward. I'm going to go down and look at 1815 in your book. We got a little nail here and a sagittal section of a nail as well, and a microscope, which we won't pay too much attention to. Pretty straightforward. You've got yellow, green, and yellow again because the uppermost layers of the epidermis are shown in yellow, and in green it's going to be in the mitotic layer. So let's start in the green layer. The nail bed. Okay, the nail bed on this diagram shows you this little pink layer deep down here. The nail bed is going to be continuous with the stratum basal and stratum spinosum of the surrounding epidermis, the surrounding skin. So the nail bed is in the deeper layers, but if you just think the bed's in the basement or the bed's on the ground, the bed's down there, the bed's on the bottom, the bed's on the ground, it's in the deeper layer. Okay, it's underneath. It's in the stratum basal. The bed's in the basement. The lunula, okay, is part of the nail plate. The lunula is this little, lunar means moon. Okay, so this little white deal, that semicircle that everybody's got on their nail, that is, it kind of looks like a moon, so it's called the lunula. It doesn't have any color because the nail bed underneath is real thick through here, so it's just all blanched out and there's no blood seen there, so it's white. But this lunula is part of the nail plate, and the nail plate is going to have different parts to it, but the nail plate is like the nail itself, what you think of the nail. And the nail plate is going to be made out of a modified and very hard stratum corneum, which is the outermost layer of the skin that's totally dead, flat, and full of keratin. Keratin, remember, toughens and waterproofs the skin. Your nails are very, obviously you look at your nails, they're very tough and waterproof, okay? Like water just beads right off them because they're packed with keratin. So what your nail plate is this like special kind of modified stratum corneum, okay, that's incredibly hard, and it has different parts of it technically. a nail root, a body, and a free edge. So the nail root is like, underneath this lumped up skin, right? Which I'm tracing here. That's the nail root, where it's growing and extending out. And then the body and the free edge, the edge of, the tip of your fingernail. Pretty straightforward. So just review these pictures a little bit, and you should be good to go. Now glands, 1816, they can be a little bit tricky, but if you just give it a few minutes, it's really not too bad. Okay, so glands of the skin, there are 3 basic types that you're going to need to know for this test. But if you kind of group them, or we will group them, and they'll be a little bit easier to deal with. Okay, first off, there are 2 different basic types of secretions that you need to know to differentiate them. One is oil, the other is water. Okay, so sebaceous glands produce an oil secretion. Okay, technically it's a holocrine sebum secretion. Now, it's basically just an oily, gooey stuff. Okay, and holocrine means whole. Okay, when you see holocrine, think the whole thing, the whole cell. What happens is that in these little glands, the entire cell, right, that line multiple cells, I guess, that line the edges of these glands, those entire cells just like fall apart and like turn into this, like nasty oil goo, right, that makes this oil sebum secretion. That's called holocrine secretion because the whole cell, just busts up and turns into this oily goo. So sebaceous glands produce oil, okay, and it's holocrine. If you see holocrine, think oil. The whole cell busts apart and turns into this stuff, okay? As opposed to a sweat gland is basically just pulling water. Okay, those cells are just like pulling water from interstitial fluid and pumping sweat through there. So it's a more cleaner, watery water solution. And there are other things that go into the sweat for different reasons, but basically it's water. Okay, we'll come back to those in a second. Sebaceous glands they're unique because they're the ones that make oil. There's only one that makes oil. It's the holocrine type of secretion, and it's the only one that has this branched type of shape. Okay, if you look on this left side over here, 1817 sebaceous glands, you can see that picture A, okay, is part of a sebaceous gland, right? Or it's a microscope picture of a sebaceous gland, and we got another view on this side. But they have this kind of branchy type of shape. Okay, they're not just a simple tube. They're branched. So this branched acinar or alveolar, like if you've seen a picture of an alveoli in a lung, they're like little branches that go out into little bubbly ends. Okay, this is alveolar. Okay, so there's branches with little bubbly ends. This is the oil one. Okay, it's like the oil tree. I say tree because of the branched shape of it. So this is a unique one. What does it do? Well, oil for sure lubricates things. That's a good guess. That makes sense. That's what it does. Oil for sure makes water like bead right off of it, and so that makes sense. And it does do that. It waterproofs the hair and it waterproofs the skin. If you go a few days without a shower, you'll certainly notice that your hair and skin gets extra oily. That is because of these sebaceous glands. Now these glands, they produce this secretion into the hair, right? So they're injecting this stuff into the hair follicle because it conditions the hair with this oil as well, to keep it healthier and whatnot. And we also know that oily skin is linked to acne, right? Real greasy skin, clogged pores makes acne. That's kind of common knowledge. So that all goes with overproduction of sebum, which is a holocrine secretion, which is oil. Okay, so we've spent enough time on that, but it's worth differentiating. So the other two types are sweat glands down here. Now notice I still have the color classification throughout this whole thing, but you might want to draw a little box, okay? Maybe I'll do this right now. We'll draw a little box around the sweat glands to differentiate them, okay? And we'll make our border, let's say blue, because sweat is mostly water, and water, in the ocean looks blue. Okay, so we've got our sweat glands in a blue box now, but the skin, the layers of the skin is where we get the color. So sebaceous glands and apocrine glands are going to be found in the dermis because they're associated with hair follicles, which you can see right here. I already mentioned that sebaceous glands, are squirting oil to condition your hair and waterproof your hair. So the hair follicle is in the dermis, right? You know that the hair follicle is deep in the skin, so you could at least guess that it's down in the dermis. Sebaceous glands are in the dermis, and we will find out next that apocrine glands, they're sweat gland. You know that these two are sweat glands off the bat because I said that. Okay, crine, anything ends in crine means it's a sweat gland. Apocrine, eccrine, they're both sweat glands. There's two sweat glands, apocrine, eccrine. The apocrine glands are all sweat glands are tubular, by the way. That's another thing here. So sweat glands, tubular, but they're in different areas, and one stinks and one doesn't. So stinky, sweaty apes, apocrine. Okay, apocrine sweat glands are a sudoriferous odor. Okay, I misspelled that. I should say sudor. No, I did spell that right. Sudoriferous sweat secretion. And they're most concentrated in the axilla, armpit, and pubic regions, okay, in your stinky armpits and in your stinky crotch, okay, and they're associated with your hair follicles, so they're stinky sweat glands that pump sweat through in your armpits and in your armpit hair and your pubic hair, okay, that's apocrine gland secretions. And they smell, and they get especially stinky, in response to stress. They call it a merocrine secretion, but merocrine is just referring to sweat. Okay, so basically it's a stinky, smelly sweat gland. Stinky, sweaty apes, hairy armpits, hairy crotch, stinky armpits, stinky crotch, stinky, sweaty apes. Okay. You can nail that, all right? Now, eccrine is the clean sweat. It's all over your body. It's true sweat, clean sweat, cools you down, and eliminates lactic acid and uric acid, okay? It's everywhere, especially forehead, okay, on your back, whatever. People sweat in different areas, but it's all over the body, not just your hairy places, okay? So, something else. This blue box means that I put a box around our sweat glands. Anything that ends in crane, the eccrine, apocrine, those are sweat glands, and both of the sweat glands are the same shape. They're a tubular, just a tube, okay, and they basically just draw water from interstitial fluid and transport it through the gland, adding other things as well, okay. This odorous secretion, okay, technically there's more going on. There's the cells are actually adding like pheromones and stuff into the apocrine secretions, and down here in the eccrine glands, there's also the cells are also adding waste products to be eliminated. So you can get as deep into that as you want to, but these are our sweat glands. They're both tubular. Stinky, sweaty apes is the stinky sweat, okay, and then ecrine's the clean sweat. If you look at this picture over here, they just kind of show you a sweat pore, and this is the tubular sweat gland. It's just kind of like a tube going up, and then this is a hair follicle here, and here's our sebaceous oil gland. It has that branched alveolar. It's like these bubbles and stuff, this different shape. Okay, squirting oil into this hair follicle to condition the hair, and then we should have your apocrine. Here it is. Apocrine sweat gland. The shape looks weird on here, but it's still described as a tubular sweat gland. But notice it's close to this hair follicle. It's associated with a hair follicle. Okay, sensory receptors, you see in my chart over here, we've already covered it quite a bit in the first video. If you have not seen that first video, I highly recommend going back to it because we've got some great ways to remember all of this. You've got pain and temperature, most superficial. Then a little bit deeper, you've got discriminating touch receptors, mechanoreceptors. These are all mechanoreceptors, but these are like helping you touch things and figure out what's touching you. Okay, Merkel discs and Meissner corpuscles. I said Merkel discs, you might think of little green men if you think in color, and you can recall stratum basale as green as far as like where's a Merkel disc? It's in the stratum basale, little green men, as in flying saucer and a disc. Otherwise, Meissner's touch, nipples as in papilla of the dermis. If you need to know where Meissner's corpuscles can be found, they're in the dermis, they're in the papillary layer of the dermis. Touch, nipples, they're a touch receptor, so that's touch, nipples. Hair root plexus is in the base of a hair follicle. You should know the hair follicle is in the dermis. You could probably nail that. Ruffini corpuscle is it's a touch receptor, but it's like you got a rough idea. So I say, I can roughly feel that. I get a rough idea of what I'm touching. It's a non-discriminate touch receptor, rough touch, Ruffini corpuscle. And then the deepest receptor is going to be the Pacinian, P for pressure, Pacinian pressure. It also just makes sense that the deeper down it is, then you're going to have to push, you're going to have to apply pressure to trigger the pressure receptor. So it's the deepest layer, and it's going to be down in the deeper dermis and even way down in the superficial fascia / hypodermis / subcutaneous layer. So lastly, we've got clinical considerations, and I'm going to pull up something in your book here that's going to show you skin repair. This stuff's pretty straightforward, but still important, so don't skip it. Wound healing, burns, and then tumors, basically, okay? A few things with aging and stuff, but first off, wound healing, okay? If you have a wound in the epidermis, then you're just going to have that, that skin replaced by mitosis, in the stratum basale and stratum spinosum. New cells will just divide and replace that, okay? But if you have a bigger cut, and so this shows you, okay, so figure 1 shows you a little more complicated with clotting and all this stuff. You don't really need to know this level of detail, I don't think, but it's here for you to get a little deeper understanding if you're ready to do that. You don't need to know all the specific cell types of what comes to the circulatory system. You've already actually covered some of this stuff when you were learning about connective tissue and fibroblasts and all this stuff before. So if you look at wound in the dermis, if you know this much, okay, that's what's in your notes and you're good. There are extra details, once again, that you don't necessarily need to know. So a deeper wound cutting into the dermis, you'll have bleeding, then you'll have platelets and fibrinogen causing a clot, which then turns into a scab eventually to protect it and hold things in place. And then you'll have inflammation, and white blood cells will cause inflammation by releasing various cytokines, okay, which you don't need to know all that, but they release little chemical messengers that attract basically more white blood cells, and you need all those white blood cells there to gobble up junk that's not supposed to be there and knock out pathogens that could be in the tissue. But basically you have white blood cells and inflammation. They go together. It's a good thing. It's a normal thing. And then you have fibroblasts will be attracted to that inflammation. Those fibroblasts, blast means to make, so they're making fibers. So they're going to be repairing and binding the edges with new fibers, collagen fibers. And then eventually you'll have epithelial cells come in through the blood or creeping in from the surrounding areas, and they're going to come in and start proliferating to create new tissue, okay, to create new epithelial tissue. This is the little more complex version. You can pause and work your way through with the pictures. You don't need to necessarily no like macrophages versus neutrophils for this class, but you will later in other classes, as in later as in other classes. So burns, you have 4 degrees of burns. Pretty straightforward because you can kind of just count it up to get to 4th degree, 3rd degree, 2nd degree, 1st degree, etc. So burns, a 1st degree burn, it only burns one layer. Only burns obviously the outside. You don't burn yourself. Well, you don't usually burn yourself from the inside. There are some circumstances that could happen. But a burn from the outside is going to burn the epidermis only, so you'll have some warmth and red and peeling like a little sunburn. A 2nd degree burn will burn 2 things. Second 2 will burn the epidermis plus a little bit of the dermis. So that's when you'll have a blister. Okay, and the healing will come directly from epithelial cells, reproducing themselves. A 3rd degree burn will burn 3 things: the epidermis, the dermis, and accessory organs in the skin like glands, etc. So you're only going to have real, like true healing at the margins of the injury. Otherwise, you'll have scar tissue, where you couldn't have a total healing. A 4th degree burn is going to involve 4 things: the epidermis, the dermis, accessory organs, and the very deep hypodermis or subcutaneous layer or superficial fascia. That is one heck of a deep burn, and you'll only have healing around the edges, and depending on how big it is, that's when you're talking about skin grafts being brought in, to replace that area. Or if it was just a tiny little 4th degree burn, then you'll just have scar tissue that your body forms in that area. So with 1st degree, 2nd degree, 3rd degree, 4th degree, just count up how many things are being burnt if it's in a question, and you'll probably get it right. But if you get something like a sunburn that's peeling, that's just a 1st degree. If the word blister comes up, then you're looking at a 2nd degree burn. Okay. Now, indicator down here, obviously the skin can tell you what's, you can look at somebody and tell something's wrong with them, and you'll learn all these different diagnostic, considerations for other classes. But if somebody is incredibly pale, okay, then, that can be a sign of disease, iron deficiency, etc. Okay, but you don't need to know exactly what diseases for this class, but it's an indicator of their diet. Heavy metals can cause various skin color changes, metal toxicities, etc. An interesting one is if you take tons and tons of colloidal silver, which is a great product for a lot of things, but if you way overdo it with silver, incredibly much colloidal silver, can actually turn your skin blue forever, which is kind of cool. If you're curious in that, go YouTube, blue colloidal silver guy or whatever, and you'll find people that look like Smurfs. Allergies, okay, obviously can cause skin changes. If you have an allergic reaction to the skin, it can tell you what's going on, or especially with medications. If somebody has this crazy outbreak of a rash, a lot of times it's from a new medication. And also, lots of different diseases can cause skin changes, lots of really gross ones too. Okay, so it's a clinical indicator for a lot of things. Aging is going to affect the skin. This is kind of common knowledge. Your skin, your dermis is less elastic, has less ability to stretch and rebound. If you pinch your skin, it probably rebounds back pretty quick, but if you pinch old grandpa's skin, it probably is pretty slow to return to its original shape. If you just do that on the back of the hand, it's kind of obvious, kind of interesting. If you're around somebody old, just your parents or something, you do that just for fun. Your hypodermis adipose tissue decreases. We've mentioned that. Hair and gland activity is going to decrease as well, so hair will grow slower and get dry and coarse, and people turn gray because those melanocytes will die off and quit producing pigmentation. Skin pigment changes will occur. People actually get, dark spots and darker skin technically when they get older. You get more moles as well. Getting into moles down here, so you've got tumors, okay, and so tumors aren't always bad. So benign tumors and malignant tumors, neoplasm, new tissue. Neoplasm means tumor. But you have some that are no problem at all and some that are a problem. And you'll want to know those differences, which are outlined here. A mole on the skin is a bunch of melanocytes. It's also called a nevus. A wart, okay, is skin tissue growth that is being stimulated because there is a virus in the skin. And a wart is also called the verruca. Those are benign and they're not going to be a problem. But note that moles can be a problem, okay, if they become a malignant neoplasm. So you need to for sure know this A, B, C, D, E rule for this test, and more importantly for your chiropractic career, to be able to keep an eye out on moles that are changing and potential problems for your patients. Malignant neoplasms, there are going to be two basic types here. You'll learn more different subcategories, but you've got carcinomas and melanomas. Carcinomas are actually less dangerous type of skin lesion or neoplasm. They come from a long-term UV exposure. So lots and lots of years of just being out in the sun. It'll be on the top of your head if you get a bald spot, or maybe on your nose. There are basal and squamous carcinomas, but basically what you need to know is that, for this test at least, is that carcinomas are associated with long-term, lifetime UV exposure, and then somebody might get a carcinoma on their nose or their back or the top of their bald spot, when they're like 45 years old. Okay, that's a carcinoma. But a melanoma is usually attributed to real intense UV overexposures, of a more brief duration, just like somebody gets a terrible sunburn, or several terrible sunburns, and they don't have much melanin in pigmenting their skin to protect them, and their body's innate ability to deal with these problems is down. That has to be included in this consideration, so don't be freaking out just because you have a sunburn, okay? But when those factors, when those stars align of a terrible UV exposure and your body's immune system is not functioning optimally, and you have pale skin, this could be a problem for people, and they basically just have a mole that changes over time and exhibits these A, B, C, D, E, qualities. So, asymmetry, borders, color, diameter, and evolution. These are all things that you need to be considering when examining a mole. To identify if it's a problem, if it's a potential melanoma, if it has a very asymmetrical border, as in like it's not a nice round or oval type of thing, if it's got a really weird shape, really gnarly looking shape, if it has irregular borders to it, if it's raised in certain areas and flat in other areas, that goes with part of this. If it has crazy colors, especially multiple colors like red and black and brown and gray. Okay, the more color variants and crazy looking colors, the worse. The bigger it is, the worse it is. They usually say like the tip of a eraser pencil, like any bigger than that, then you should start keeping an eye on it. So the tip of an eraser pencil, I don't know, a couple centimeters, something like that. And then evolution, maybe the most important, if it's changing and how it's changing over time, and if it's bleeding and doing weird things and never goes away. Skin will change. Skin reproduces, and all the time your skin is sloughing off and growing at the deepest mitotic layers. So these things can slough off and your skin will change, but this ABCDE rule is something you need to put in the long term memory bank. It will be on your test, and it will be important for your clinical career. So that's going to conclude everything that we've covered. Best of luck. Use the book, and remember to use your nipples on this exam.
I don't need luck. I'm good.